B virus in Mauritania, genotype and vaccine escape mutation in patients with active infection. I will now briefly present the infection mechanism of the hepatitis B virus. Hepatitis B virus is a partially double-stranded DNA virus that primarily infects hepatocyte. Infection begins with viral attachment to the anti-CP receptor via its Preas1 domain, allowing entry into the cells. The viral DNA is then transported to the nucleus, where it is converted into cccDNA, a highly stable form that persists as a mini chromosome and represents the central reservoir of infection. From the cccDNA, nucleocapsids are produced. Some return to the nucleus to maintain the cccDNA pool, while others are released as infectious variant. A portion of the viral DNA can also integrate into the host genome, contributing to the persistence of infection. HBV exhibits significant genetic diversity with 10 genotypes A to G distributed differently across regions worldwide. Worldwide, around 254 million people are currently living with chronic hepatitis B infection, which represents approximately 3.3% of the global population. Every year, about 1.2 million new chronic infections are reported, indicating that HBV transmission remains a major public health challenge. One of the most critical issues is underdiagnosis. Nearly 87% of infected individuals are unaware of their status, which leads to delayed diagnosis and limited access to care. As a result, only a very small proportion of patients receive appropriate treatment. In fact, less than 3% of people living with chronic HBV worldwide are currently receiving antiviral therapy. These figures highlight a significant gap between available medical solutions and their real-world implementation. In this context, Mauritania is classified among countries with hyperendemic prevalence of hepatitis B, meaning that the infection remains highly widespread in the population. Hepatitis B virus is a major risk factor for the development of hepatocellular carcinoma, the most common form of liver cancer, according to data published by the International Agency for Research on Cancer. Liver cancer occupies a highly concerning position in the oncological landscape of Mauritania. It ranks second among men, third among women, and also third overall across both sexes. In terms of incidence, liver cancer accounts for approximately 9.3% of all cancer diagnosed in Mauritania. Moreover, the mortality rate associated with this cancer is also very high, reaching around 9.1, reflecting its severity and poor prognosis. Hepatitis B virus is highly vaccine preventable disease, with early vaccination showing 95 to 100% efficacy and drastically reducing mother-to-child transmission. However, the emergency of vaccine escape strain with mutation in the A-determinant region that allow partial evasion of vaccine-induced immunity poses a challenge. Certain viral genotypes are more prone to these mutations, emphasizing the need for ongoing molecular surveillance to maintain the long-term effectiveness of vaccination program. The S region of the hepatitis B virus genome encodes the surface antigen HBs antigen. These regions contain the A determinant as well as vaccine escape mutation, which can alter immune recognition. This critical region spans from amino acid 124 to amino acid 147. The objective of our study is to characterize HBV genotypes and the clinically relevant mutation, including vaccine escape mutations in patients with active HBV infection. After obtaining the ethical approval from the Ministry of Health, we began recruiting the samples. Our strategy was to first perform the total anti-HBC serological test. Individuals who tested negative were excluded and referred for HBV vaccination. For patients who tested positive for anti-HBC, we performed an HBS antigen test. Those who were positive then underwent an HBV viral load test, and if the virus was detected, the HBV infection was confirmed. Among 1,282 patients positive for HBV, the results of the viral load are as follows. 447 patients had an undetectable viral load, and 885 patients had a detectable viral load. Among the latter, 646 had inactive infection defined by a viral load below 3.34 log, while 189 had active infection defined by a viral load above 3.34 log. Among these 189 patients, 98 gave their consent to participate in the study. The prevalence of active infection is 14.74%. The demographical data of the included patients are as follows. 58.3% are men and 41.7% are women. Regarding our distribution, 21 patients are between 5 and 25 years old. 55 patients are between 26 and 50 years old, and 20 patients are between 51 and 71 years old. The distribution of viral load among the included patients indicate that 41.8% have a viral load greater than or equal to 6 log, which corresponds to more than 1 million copy per milliliter, reflecting a high level of viral load replication. The assessment of liver marker reflecting the degree of inflammation shows elevated transaminase levels. We extracted HBV DNA from blood samples collected in Mauritania. These samples were then shipped to the University of Alberta under the approval of their research ethics board. We performed nested PCR to amplify the viral DNA, followed by gel extraction, and finally the DNA was sequenced using Sanger sequencing. The sequence were aligned using MEGA12, and the inclusion of the targeted region was confirmed. The genotyping results showed that the analyzed strains were distributed as follows: 16.4% for genotype G, 37.5% for genotype E, and 2.1% for genotype E. Among genotype G, 56% had subgenotype D. On this slide, we present the mutation identified in the 8 determinant of the hepatitis B virus from 95 sequenced sample. 4 main substitutions were detected: serine in position 143 replaced by leucine, and threonine 131 replaced by isoleucine, and threonine 140 replaced by isoleucine, and alanine in position 128. The serine 143 replaced by isoleucine found in 2 samples is known to cause classic vaccine escape. The T131 isoleucine substitution, also present in 2 samples, confer escape from hepatitis B immunoglobulin and immune evasion. In these samples, T114 isoleucine detected is 1 sample has a similar effect escape from hepatitis B immunoglobulin and immune evasion. Finally, 1 mutation are found in genotype E in 1 samples. Primarily leads to immune escape. Regarding genotyping, the S143 leucine and T131 isoleucine and T140 isoleucine substitution all belong to genotype D, while A128 valine substitution is associated with genotype E. Our study highlights that 14.74% of patients were in the active phase of HBV infection, indicating a substantial proportional at increased risk of disease progression and underscoring the importance of targeted monitoring and management. The geographic position of Mauritania at the crossroads of North and West Africa has led to a diverse HBV genotype distribution, with genotype G and genotype E predominating, alongside the presence of genotype A. Furthermore, the detection of vaccine escape, immune escape, and hepatitis B immunoglobulin escape mutation emphasizes the circulation of variants that may compromise current prevention strategy, highlighting the need for continuous genetic surveillance to optimize vaccination program. Our future direction created public health advocacy documents present this finding to the Mauritania Ministry of Health, publish these findings in a scientific article to enhance their visibility and international credibility. I would like to thank the team at the Meyer Stephenson Lab, especially Kathy Thompson, Andrea, and Flor Angela Diaz for their outstanding work in processing the samples, and the team at the National Institute of Hepatovirology. Thank you for your attention.